Everyone, my name is Esther. I am, like Tina mentioned, a one of the nurses for the Cancer Supportive Care Program within Stanford Healthcare. The Cancer Supportive Care Program is actually a free wellness program open for any cancer patients and caregivers at absolutely no cost. It's something that Stanford pays for because they've seen the firsthand benefit of patients really participating and partaking in this program with benefits. So I always tell cancer patients and their caregivers, please feel free to take advantage of it if you can. And I'm here today to talk about cancer prevention, specifically for lung cancer, and what are some of the ways for screening for lung cancer as well. So to begin with, I'm going to start by just reviewing the top 10 cancer rates that are being newly diagnosed on a yearly basis. This graph is actually from 2018. As you can see, the female breast cancer is really the highest and actually the most toply diagnosed cancer back in 2018, and lung and bronchial cancer is number 3. But on this graph, you can actually see that the highest death rate is actually from lung and bronchial cancer, but not breast cancer or other highly diagnosed cancer. And I'm going to just go into the anatomy a little bit of how lung works. So bear with me and feel free to jot down any questions that you have. I'd love to kind of review it deeper if you guys would like to. Humans, all of us, have 5 very vital organs that we need to live. They are the brain, heart, kidneys, liver, and lungs. And your lungs have 2 sponge-like organs in your chest, and your right lung has 3 sections, and each one of them is called a lobe. So it has upper, middle, and lower lobe. And your left lung has 2 lobes. The left lung is smaller because your heart, the placement of your heart actually takes up more room on that side of the body. And so when you breathe in, air kind of enters through your mouth and nose and kind of goes into your lungs through the trachea, which is also your windpipe. The trachea divides into tubes called the bronchi, which enters into the lung and divides into even smaller bronchi. And these divide to form even smaller branches called the bronchus. And at the end of each bronchus are tiny air sacs called the alveoli. The alveoli actually absorbs the oxygen into your blood from the inhaled air and remove carbon dioxide from the blood when you exhale. Taking in oxygen and getting rid of the carbon dioxide is actually one of the main functions for your lungs. And lung cancers typically start in the cells lining the bronchi and parts of the lung, such as the alveoli. A thin lining layer called the pleura surrounds your lung, and the pleura protects your lungs and helps your lungs slide kind of back and forth against the chest wall as they expand and contract while you're breathing. And below the lung, a very thin dome-like muscle called the diaphragm actually separates the chest from the abdomen. So when you breathe, the diaphragm moves up and down, kind of forcing the air in and out of the lungs. And I'm going to also focus on some of the risk factors of lung cancer so that we can better understand what might be some of the contributing factors of what causes lung cancer. So in this, on this graph, you can see this is between 2012 to 2016, and this graph actually shows that the average age of lung cancer diagnosis is actually right at 70, which is, a little bit older. And one of the reasons why is a lot of people question, like, why is it 70 not earlier, since we have seen a fair actually increase of lung cancer at a earlier age. And one of the one of the things that we have come up with is, well, Medicare starts at 65, and a lot of older adults actually won't do any type of cancer screening or even like go see a doctor until they have insurance coverage. Once they have insurance coverage, and secondly, a lot of the lung cancer is actually asymptomatic, so patients just don't know that they have lung cancer. And this is actually rates of lung cancer cases based on race and also gender. As you can see, in United States, African American men have the highest rate than any other races, and a lot of beliefs is because the higher smoke rate is just much higher in the African American community. There is a new data lately that have shown Asians have a overall lower rate of lung cancer in comparison to other race. However, Asian men and women who were born outside of United States actually have a 35% higher incidence of lung cancer than US born Asians. One of the beliefs is also that Asians who were born outside of the United States, their secondhand smoke rate also is much higher, and the smoking rate in Asia is just a lot higher than United States. And the next topic, next risk factor we're going to focus on is the socioeconomic status. A lot of studies actually have shown the incidence of lung cancer has increased in people with lower educational levels, lower income, and just overall blue-collar occupational positions. And a lot of it is due to the fact that they just have a greater prevalence of cigarette smoking. And lately, with also the younger generation with the vaping, that has also caused a quite an increase of different type of not necessarily lung cancer, but a lot of it is precursor to lung cancer. So diet, actually, as you guys are all probably aware, diet, has a humongous effect on our body and on our health in general. Processed food has a lot of poor nutritional values, and it makes you, some of them even have an addictive form that makes you just want to keep having more and more of it. Although there hasn't been a study that has proved that there's a direct correlation between diet and lung cancer, but there has already been study and data that have shown excessive caloric and dietary fat that has the increase in those two areas in your diet has been linked to breast and colon cancer. And right now there are a lot of studies that are going on that is hopefully able to identify what are some of the foods that we should really be focusing on, and what are some of the food that you shouldn't really be having too much of. I mean, the rule of thumb is we really encourage green, leafy greens, and also fresh fruits rather than canned food, and decreasing red meat intake, no more than 3 to 4 servings a week. So these are just general guidelines of healthy eating on a regular basis. Another risk factor for lung cancer is actually pre-existing lung disease. Like I mentioned before, the vaping has caused a lot of emphysema for the younger generation who have been we have seen a huge increase of use. Emphysema is actually one of the pre-existing lung disease that can be a precursor for lung cancer. COPD, fibrosis, or history of pneumonia or mycobacterial disease. These are all believe that the inflammation process from these disease are actually can play a role in lung carcinogenesis through the increased genetic mutation. As your lung is constantly in an inflammatory state, it can actually cause more genetic changes than not. And the scarring in the lung is also linked to the development of lung cancer at that site in the future state. Environmental factors. This is actually a pretty big one because a lot of the things is within our control. Some of them are not, and environmental factors is one of those that we really have to be mindful of where we are and who we are next to. Secondhand smoke is just a huge factor. Multiple studies actually have shown non-smoking spouses of smokers approximately have 20 to 30% of increased risk of lung cancer because of the constant exposure to secondhand smoking. Smoke from other people's cigarettes, pipes, or cigars also can cause lung cancer. When a person breathes in the secondhand smoke, it's like he or she is smoking. So within the United States, 1 out of 4 people who don't smoke, including 14 million children, are exposed to secondhand smoking just between the period of 2013 and 2014. Radon is actually a naturally occurring radioactive gas that results from the breakdown of uranium in soil and rocks. You can't see it, you can't smell it, you can't taste it. But according to the U.S. Environmental Protection Agency, EPA, you probably have heard of it, radon is actually the second leading cause of lung cancer in the country and also the leading cause for non-smokers. In the outdoors, there's actually little to none radons so it's not likely to be dangerous. But within indoors, it can be actually in a more concentrated amount, and breathing in can expose your lungs to small amounts of radiation, and it actually does increase a person's risk for lung cancer. So homes and other buildings in nearly also all of the United States can have a higher indoor radon levels, especially in homes that have basements. So also people who work with asbestos, such as mines, textile plants, places where the insulation is used, also shipyards, are just several times more likely to develop lung cancer and die from it. And also people who smoke and work in those settings just have a much greater chance in developing lung cancer. So this is probably not a relevant factor in the recent years, but in the older days, families who actually use burning coals to cook, and also the fumes from burning the coals from the cooking oil can also be can also pollute the air that you're breathing in. That can also actually increase the risk of lung cancer. Occupational exposure. In 1982, a list of occupational exposure actually has been developed, and these between the list A and B, I just listed some common ones that have been shown that have increased risk of lung cancer development. And like I mentioned, the asbestos production, shipbuilding, construction, or even any type of meat production factories, or woodworking, rubber and glass manufacturing, motor vehicle production. So like workers like in the Navy, or mechanics working with bricks and tires, like these workers tend to actually have a higher incidence of lung disease and lung cancer. Genetics. Many of you probably have heard, like, ancestry, I think 1 to 23, or other genetic kits that are readily available for you to kind of test. Genetic counseling is actually one of the highly recommended specialty that oncologists would recommend patients to kind of to go through, because that actually shows what type of some of the known genetic mutations that can cause cancer, and you can actually work much closely with your physician to identify what are some of the screening tools that you can use. The greatest risk for developing lung cancer is actually cigarette smoking by a large margin. Age, radon exposure, gender, race, lung disease, pre-existing lung disease, these are all important contributors. However, not all people with these risk factors develop lung cancer, and some without any known risk factors actually do develop lung cancer, and that also indicates the importance of genetic factors in contributing to developing this cancer diagnosis. Actually, some history, even though hasn't been proven that lung cancer and genetics don't have a direct link, but that we have seen that if you're a lung cancer survivor, the risk for you to develop another lung cancer, especially if you continue to smoke, is actually much higher. And if you have a parent or a sibling or children that have had lung cancer, and also if they also is a smoker or work in a place that they're exposed to the various environmental factors, that will also increase the risk of developing lung cancer. We have talked quite a bit about smoking and how it can be a huge factor in increasing your risk for developing various of lung disease, and hence some of them will result in lung cancer. But it is such a big contributing factor that we have just seen like 20% of all the cancers were really in some direct and indirect link to smoking, and 30% of all cancer deaths have some direct and indirect links to smoking within the United States. And about 80% of the lung cancers, as well as the 80% of the lung cancer deaths, are all partially due to smoking. And like the second slide that I have shown in the earlier in the presentation, that lung cancer is the leading cause of cancer death within both men and women. So what are some of the interventions that we can implement to decrease the risk of lung cancer? First is smoking cessation. If you're smoking, really try to work with a tobacco cessation program, either within your healthcare system or speaking with your primary care physician to develop a plan on how to decrease the amount of cigarettes that you smoke or vaping that you use. Just avoiding areas that have a lot of secondhand smoking, and really advocate for yourself to work in a place that is a smoke-free space, and really preventing yourself from exposing to the different lung carcinogens in your workplaces. So I'm going to actually talk a little bit about lung cancer screening. These are the two criteria that if you fall under, I would highly recommend actually getting screening. Criteria one is if you're between the ages of 55 and 80 years old, and if you're currently smoking or if you've quit within the past 15 years, screening, you would not need to be screened if you have not smoked in the last 15 years. But however, if you have a history of at least 30 pack a year, a pack a year equals the number of packs smoked per day times the number of years the patient smoked. So 2 packs a day for 10 years equals 20 pack years. So if you have at least a 30 pack year of smoking, I would highly recommend please go to get your screening. criteria too is if you're over the years of 50 years old and you have at least a history of at least 20 pack years of smoking, or if you have one additional risk factor, which is the radon exposure or occupational exposure, um, cancer history, any type of cancer history that's listed here, or family history of lung cancer, or if you have any of the pre-existing lung disease that I mentioned, like emphysema, COPD, pulmonary fibrosis, please do have a lung cancer screening soon. Within Stanford, there is we recently actually launched this, it's called the lung cancer screening within Stanford Imaging. A lot of the insurance actually do cover this particular screening process as a preventative medicine. However, I would highly recommend calling our insurance or giving us a call at the number here at the left upper corner. Just give us a call and ask if you are interested in just finding out more on the steps to get a screening for lung cancer. I also I have two links here that you can find out more, even if you're not part of the Stanford Healthcare. Whatever insurance you have or whatever coverage you have, I would highly recommend reaching out to them and just learning more of their lung cancer screening program and see how you can take advantage of it for yourself or for your loved ones in the community. And that actually concludes my presentation. So I would love to take any questions that any of you guys might have, and ask away.
I have a question. When you talk about radon exposure within your house, how do you know that there's exposure?
So that is actually one thing there is the building of the house. There was a certain year within actually within the United States where they didn't have a lot of control or a lot of legislation on different building codes. So I will find out the year of your house that is built, and actually that's a great question. When I presented on this last week, someone actually asked, how do you know if you have asbestos in your house? And my recommendation is you should be talking to your landlord, and there's actually companies out there that will come out to your house to find out if there's actually asbestos exposure within the house, and they will actually work on removing it. And for radon, that is, I want to say there are also companies out there that will find out if there is. However, I will first find out the year of the house that is built, and also going to the city that you live in and ask, is there a known radon exposure as the house is being built? Because it's unfortunately it wasn't really a known fact until I would say in the last 20 years or so. So the legislation hasn't been that strict as they are doing development of houses back in the day.
Got it. Thank you so much.
Yeah, of course.
What are the, you may have touched on it, what's the survival rate for lung cancers currently?
That is a good question. I would say it really depends on the staging that you're diagnosed at, and if you have any other comorbidities. Like we actually have seen a lot of younger patients, like who are less than 50 years old, or who are right about like 50 years old. A lot of it, if it's a genetic mutation, it tends to actually be harder to treat. However, there are just a lot of medical, like within medicine, there's just a lot of discovery in the last, I would say, 5 to 10 years, where we're developing immunotherapy, biotherapy that are a targeted therapy, where they're able to kind of target your cancer cells specifically. And so, in that sense, because that is still an ongoing study, if you will, and so the rate, I can't say, I can kind of give you a number saying overall the survival rate for all the lung cancer patients is this number, because it really depends on the staging. Of course, the earlier you're able to be diagnosed, the better chances it is.
Okay, so what's the stage of the cancer illness matters, and then also the individual biological makeup.
Yeah, and also the health of the individual. Like, let's say if you're just a healthy, person to begin with, we don't have to worry about as many comorbidity monitoring or management as we are dealing with your cancer treatment.
Okay, thank you.
Yeah, of course.
What are the symptoms of lung cancer? And when you do the screening at Stanford, what are they screening for? Are they giving you a scan?
Yeah, a lot of times because early stages really have no symptoms, they're completely asymptomatic. The early stages diagnosis can be actually very accidental, like where they might just do an X-ray and they see like some sort of like shadowing or like a spot, like, and they might do further testing just to identify what that is, and that's how they find out if this is like a lung cancer or a mass or a tumor, because the symptoms are so I would say like minimal or sporadic that I can't say for sure if you have a cough you should go get an x-ray, like that is definitely not it. However, if you have like this persistent cough, or if you have night sweats, or if you have like recent weight loss more than like your usual weight loss, or if you have if you like, sometimes it's just like in the movie some patients like cough up blood, and I'm like, why are you not seeing a doctor? And sometimes it's not lung cancer, it might be emphysema, or it might be some sort of infection in your the pleura of your lining of your lung, whatever it might be. It's much better to get checked out. And even if it's an infection, you want to have some sort of medical interventions to really deal with that, rather than having a prolonged course of infection that that you don't want to deal with it without any type of maybe antibiotics or other type of medicine. Actually, that leads me to actually, I mean, I don't plan to put a plug on it, but tomorrow from 1:30 to 2:30, we actually have a consultative medicine physician. Her name is Dr. Linda Gong, and she's actually going to be talking about some of the symptoms that people always ask, do I have cancer? And her topic, the name of her lecture is actually called Puzzling Symptoms, Is It Cancer? If anyone's interested, please reach out, and I'll share the information with Tina just in case if anyone is interested. You guys can actually register directly and dial into that seminar as well. She's going to really dive into what are some of the symptoms that we really should be checking out for, and some of them, or what are some of the symptoms that is probably not too serious that you don't have to be so worrisome, but that is actually a great question.
I have two questions. One is, it came a little late. Are you going to have the slides emailed to us or anything like that? And that's the first question. The second question is, if you're exposed to a lot of secondhand smoke, what's the criteria for any kind of screening?
So yes, I would be happy to share the slide with Tina so that she can also forward that on. Lung cancer screening for secondhand smoking, like I mentioned, one of actually is constantly being exposed to secondhand smoking. It is just like you're smoking it. So if you are being exposed to a pack a day every day for, let's say, 10 years, then you have a 10-year pack year. You have a 10-pack year of smoking. That is how we would define it. Let's say if you have a family member or a friend that you are living with and you're constantly in contact with, and they smoke like whatever they're smoking, and you're directly next to them and being exposed to it, we are actually counting that as if you are smoking it as well. So that is something we really try to emphasize is if you have someone that smokes within your family or someone that you live with that smokes, I would highly recommend if they can, just maybe smoke outside in an outdoor setting, or even go away at least 15 feet from where the residence is, like to just be far away and finish their smoke, put out the cigarette safely, and then come back in and share the space again with other people.
Yes, I have like the problem is my neighbors downstairs smoke a lot. So it's not like within the family kind of thing. So
yeah, it might be worth a conversation with them and just ask if they can smoke outside rather than within the building or within the residence. It's also not good for for them to be really smoking indoor anyway, because then they are also breathing in all the secondhand smoke that they just breathe out. So I I would highly recommend just being able to keep that space.
Okay, thank you very much.
Yeah, absolutely.
Esther, is smoking cigar a little bit better than cigarettes?
I think there's a lot of misconception about cigar is like a higher end of cigarettes. I think the concentration of tobacco is actually higher in cigar, so it's not better. From what I've heard, I am not a smoker, but from what I've heard, people who smoke cigarette versus people who smoke cigar, I think it's a preference. And I think it's also the frequency. It tends to be that those who smoke cigars don't tend to smoke as frequently than those who smoke cigarettes. So maybe their exposures technically are not as frequent as those who smoke cigarettes. However, because the concentration of tobacco within a cigar is actually much higher than a cigarette, I would say is not good. If you can, don't smoke it.
Yeah, I only ask because I know people don't inhale with cigar; they puff it out.
But there's a good point. However, people because this is a lung cancer specific talk, but if we just focus on smoking, as the act of smoking, whether it's cigarette, whether it's cigar, or whether it's e-cigarette, you are changing a lot of the cell structure within your oral cavity. So actually patients who smoke, whether cigar, cigarette, they might not breathe it into their lungs. However, they are causing damages to their oral mucosa. We see a lot of head and neck cancer from patients who smoke or long periods of smoking, or people that have been exposed to cigarette smoking because they kind of let it sit around their nose and their mouth area. So there's tongue cancer, there's oral, like there are actually cancer that can develop within your mouth. There's also nasal cavity cancer, head and neck cancer is actually has been, and there's an increase of incidence of head and neck cancer in United States, I would say within the last 30-40 years. And a lot of it I don't think it's because we have an increased amount of cigarette smoking. I think a lot of it is because it wasn't really diagnosed properly in the past, and now that we have the technology to be able to diagnose it and actually have surgical removal or whatever treatment that we have available. So it's not better in the sense. It might be better for lung cancer prevention, but it's not better in the sense of our overall health standpoint.
Thank you.
Yeah.
Any more questions? Feel free to unmute yourself. If not, we will get the
One
presentation.
more.
Yep, go ahead.
I was wondering if there are any known ways to strengthen your lungs. You mentioned diet, and of course exercise, but like, are there any specific foods or form of exercise that promote lung health?
That's a great question because in my earlier presentation I definitely have mentioned, there are just a lot of ongoing studies that are really trying to identify what are some of the foods that can have a direct that shows a direct correlation of lung cancer development and or prevention. And there's not any proven food yet. However, just from a wellness perspective, if you are getting your adequate amount of sleep every night, allowing your body to do is the work that is really, that you're born to do by repairing all the cells that or repairing different things that are not going well during the day, and allow your body to have that restful period of sleep at night and repair those broken cells or whatever it might be. It just increases your chance of having cells from mutating, and also allowing your body to have that restorative period. So that's really really key. Another one, like you mentioned, exercise. When you're taking a walk outside, running outside, breathing in fresh air rather than sitting in front of a TV or computer, whatever bit on a desk, really making sure you're moving. Breathing in and out of your lungs, deep breathing is actually something that we really highly recommend for anybody. Being able to exercise, like open up your lungs as much as you can, having like deep breaths to kind of exhale, inhale, but doing it in a more open space, and again, away from any type of maybe car exhaust or like smoking or any type of contaminated or polluted air that is going to only help. I wish I can tell you like you should be eating more ginseng or whatever it might be that can help, but there really hasn't been any proof.
Thank you.
Yeah, of course.
I have a question. You mentioned that there is no genetic factor or risk factor with lung cancer. So if a parent had non-small cell lung cancer, you're saying there is no genetic factor for the children?
Sorry, so there is so on the slides I actually wrote lung cancer and genetics do not have a direct link. That means there hasn't been identified for example, BRCA. Some of you probably have heard of it. BRCA gene mutation. All of us have BRCA1 and 2 genes, but if the BRCA2 gene in your body has been mutated, your risk for breast cancer, ovarian cancer, prostate cancer actually will increase tremendously. So far, there hasn't been an identified gene that we have found in our study that shows if you have this gene mutation, then your chances for lung cancer prevention increases. We haven't found that. However, what I actually have shared before earlier in the presentation is that if you have a family member, like a immediate family member, like a parent, a sibling, a child or children that have developed lung cancer, your risk, and also if you are a smoker and have exposure to the different environmental factors I've mentioned, your risk for lung cancer does increase.
And so that should one then be not the smoking factor, other factor, but just a family member. So then should one get tested and be tested for lung cancer?
So I would highly recommend, make sure you're going to your physical every year. For anyone that has a family member that has lung cancer, I would highly recommend, if you're able to, every year make sure you get your blood drawn. A lot of the times, and I think it also depends on the practice of your primary care physician. Some primary care physician, as their annual, they actually send you out for a X-ray just to make sure that everything looks good on your X-ray result, especially with the family history of lung cancer, just as a preventative or screening tool that they would use. And if they don't, I think it's definitely worth a conversation to say, like, I have a family member who has has been diagnosed with lung cancer. Would it make sense for me to actually get an X-ray just to make sure that I'm being screened on like a on a regular basis? And of course, for yourself, I would be kind of, looking out for if there's any persistent cough, if there's any night sweats, or unexplained weight loss, anything out of the ordinary of what you would normally feel. I would definitely report it to your primary care physician, and just kind of really keep an eye out for it,
Thank you.
of course.
Yeah, that's a good idea. And of course, if we are concerned about anything, we should advocate for our own health
Hmm.
with our doctor.
I always say, like, doctors are also human. You know, we all can use a little bit of advocating for ourselves and a reminder to your medical team. So it's always a good idea just to ask the question of, hey, this is what I have on my mind. What do you think? And kind of just bounce ideas off from him or her as well, and see like what their opinion is. And especially someone that you have a long-standing relationship with, that you trust, I think it's definitely worth having that conversation.
Thank you so much, Esther. Has been so very, very helpful.
Oh, absolutely. Um, it, it's great to spend this morning together. Like I mentioned, I'll be forwarding my slides to Tina, and also tomorrow's talk, if for anyone that might be interested. It is on Zoom. And please feel free to let me know if you have any other questions.
Thank you, Esther. We will talk to you soon. Take care. Bye-bye.
Thanks, everyone. Bye-bye.